Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Personality disorders. The term personality disorder, or PD, naturally carries some specific and negative connotations in many walks of life. However, the term itself should carry less negative weights when properly understood. Indeed, the term has become a common sticking point for those who see personality as entirely without any kind of subjective description. How, then, can someone be labelled as having a disorder for something that has no universally agreed upon concept? This is one of the most striking parts of the argument around personality disorder. Despite such critique, though, it's easy to see that some people suffer from major and persistent threats to their mental health. It's often seen that someone with personality disorder may be on the run or suffering from a criminal background, but it's often not the case. For those who have heard the term or wish to know more about what personality disorder involves, this article should help you to better understand what it is and why understanding it matters today. What is a personality disorder? Typically, a person diagnosed with a personality disorder can be described as someone who has a range of enduring and uncharacteristic traits that cause them a sense of personal unhappiness and suffering. This makes it hard for them to cope with their day-to-day life and can ensure that they struggle to live a happy and competent and well-managed lifestyle. One of the main reasons why this has become so important to determine is the fact that most of the people who suffer from personality disorder will have one of the following: a neurotic mindset that lacks any kind of genuine stability, the desire to be introverted and to avoid sharing anything about themselves with others, an antagonistic personality that sees them on a perpetual path to disagreement with others, a total lack of self-discipline that makes it hard for them to conform to normal rules, no desire to really experience anything new and to stay within their own specific lines. These are among the most common problems associated with someone who has a personality disorder, and has become a major sticking point for those who are looking to better understand the condition in its entirety. While many people find that there is a rather unique outlook for each person who has personality disorder, the 5 major factors above tend to play a leading role in making sure that it can be diagnosed better. How, though, would one go about classifying this particular disorder? Causes of personality disorder. One of the most common reasons for someone to suffer from personality disorder stems from genetics. Around 40 to 50% of variance in participants among studies in the past showed that around half of those tested had a genetic reasoning for their issues. It can be family-based too. Coming from an antisocial family or a family with a high schizoid or schizotypal background would make it more likely that another member of the family would suffer in the same way. Life experience, especially in childhood, can play a major role in making sure that you can make the right calls. This can lead to vulnerability, psychological, and can usually make it hard for the person to see life from another angle due to the deep-set nature of childhood experience. Gender matters too. For example, men are more common to suffer from antisocial personality disorder, while women are more likely to suffer from borderline personality disorder. While not everyone who goes through a major traumatic experience will develop a disorder, it is linked with good reason. For anyone who feels like they may suffer from anything discussed here, reaching out for help is absolutely essential. You do not have to face personality disorder alone. Help does exist, and it's here to help you overcome these issues. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media and we will answer those questions in upcoming either video content, and of course when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.